This is one of the few practices where I have kept coming back. I know it's unconditional fear of the dentist. I've jumped around to several different dentists. And this is the one where I've kept coming back, and I'm actually to the point now where I don't have to have somebody to come with me.
Dr. Dine is very professional, and he also can have some humor and sense of funness with him. He's just an all-around great guy and makes you feel comfortable.
Dr. Dine also is the only dentist I've ever had that has, every time you come, he sends you a handwritten personal thank you note for visiting. And that was really impressive to me that he takes the time to do that.
He's just very down to earth, very upfront, very soothing. Like I said, he's got a soothing voice, very calm.
They were very gentle, and he told me what he had to do, how much it was going to cost up front, and everything. And he treated me very well, and he did it in some easy steps. And now I come and see him every 3 to 6 months. And at the age I am now, almost 60, I still have all my teeth because of him.
He's a family dentist, is what I like to consider it, and he does. He really cares about the individual patient.
Hello, let me be the first to welcome you to Dr. Dine's dental practice. You're in store for a truly excellent dental experience here. In this brief video, we'll walk you through what we think are really important aspects to your absolute dental health and complete well-being as a happy, vibrant, self-confident person. We'll also provide you with some information as to what to expect from the expert care you'll receive as a patient. If you're like most of our patients, you've done your homework regarding you and your family's dental care. Unfortunately, dentistry, dentists, and dental practices are not as they used to be. Dental students are graduating at an annually increasing number. To accommodate all these new dentists, the number of group and corporate dental offices increases each year. They, unlike our practice, are intended to see a huge number of patients, and all too often the patient's comfort and care gets sacrificed. Patients who've experienced these types of practices often identify them as dental mills or carousel dentistry. Patients who left those practices have told us they rarely saw the same dentist twice. We don't think this is how patients should be treated. Dentistry is not a take a number, next patient kind of system. Your care should not be left to the spin of a wheel to see which doctor is next up on the rotation. That's not dental care, that's assembly line dentistry. If you're comfortable with this kind of attention or lack thereof, then our practice may not be for you. However, if you're looking for a dentist and team to really care about and for you, then you're in the right place. You'll find Dr. Dine to be a refreshing change to what you've experienced in the past, to be very much the dentist your parents and grandparents came to know. More than a caregiver, an extended member of the family.
Whenever I recommend people, I take my word as something that I hold valuable, so I just don't recommend anybody. And so my sister-in-law comes to him. I've recommended family and friends. People that I know I'm going to see again are the ones that I recommend to Dr. Dine.
It's kind of like family. You feel like you're part of the family. I mean, when you go back and you work with the dental tech, she knows things about you, like they know about my daughters, they know about the babies coming. They make you feel like family. It's not like you're a patient. You're like a family member. And that makes a big difference because it puts you at ease, it makes you comfortable. And that's what I think I like most about this office, is everybody is so friendly and outgoing and make you comfortable.
I'd avoided going to the dentist for a long time because of my last dentist. Wasn't a good experience. And she recommended Dr. Dine as a good dentist to go to if you're chicken about going.
I think Dr. Dine, if I could describe him in one word, would be gentle. I think that he truly is concerned about his patients and whether they're feeling any fear or anxiety, and tries to make that experience as calming as possible.
Few people know it. Dentists, like physicians, take a Hippocratic oath. Dentists commit to how they'll care for their patients. As much as dentistry is a high-tech science, it's also an art. The art requiring compassion and care for the patient's well-being and balancing it with the science of taking care of teeth, gums, and health. You're either smiling with confidence or hiding in shame and embarrassment.
Well, I went through cancer treatments and we ended up taking all my teeth out. So now I got all new teeth. I had no smile. Now I have a smile. I started coming to him about 20 years ago, and I told him then I didn't really think that they were worth saving. And he said, oh, no, we got to save them. So we tried, but probably would have succeeded until the leukemia, and then the chemo just screwed up the works. So they were falling out on about a 5-week average. I'd lose one. I only had like 11 teeth left anyway, so now at least I can chew stuff. Even when I had teeth, he was very good about the painkillers and stuff like that as far as shots, and you didn't feel anything. If you felt something, he was like, okay, we'll stop. We'll get that squared away. He was really, really aware of that. Sometimes I wouldn't even say anything. He goes, you felt that, didn't you? I go, yeah. Okay, well, I'll get it, simple, painless. Never felt anything.
I never stayed with a dentist that I've gone to before because they just never made me feel comfortable. I'm always a nervous wreck before I come, even here. But once I'm here, he puts me at ease, and the staff is great with that too. So I come from that old school where they would hold you down as a kid and work on your teeth, and I just have nightmares of stuff like that. So he doesn't do that, and he's great. I'm not great with dentists, and I've been through a bunch of different ones trying to find the right one, and now I finally found him.
He's a family dentist, is what I like to consider it, and he does. He really cares about the individual patient. Always follows up. If you had, like I had a filling filled once, and then he followed up a couple days later, checked to make sure I was all right. He seems like he really cares about his patients. He really does. Wasn't painful at all. I mean, he numbs you, takes care of it right then and there. It was very quick turnaround to get all that done.
Many patients first come to the practice for a checkup or cleaning. There are many patients who fear going to the dentist for a number of reasons. For some, it's because they had a bad experience with a dentist as a child. For another, it's because they haven't seen a dentist in many years, and they're afraid they might get chastised for it. Not here, not by Dr. Dine. He's a no-guilt, no-lecture dentist. He's a person just like you, and he knows that life gets hectic and things can get in the way.
I have a lot of patients that come in and haven't been to the dentist for a long time. And the first thing they say to me, they're embarrassed, or they're afraid that I'm going to be mad at them and give them a hard time. But my feeling is I'm not going to embarrass anybody, I'm not going to make them feel guilty, and I'm not going to lecture them. I'm here to help people. Everyone is treated with respect, so whatever has happened in the past is the past. I just want everyone to come in, get their teeth taken care of so they have healthy teeth and gums for their entire life.
I hadn't been to a dentist in like 20, 25 years since I was a kid. He caters to chickens, and that's what I am. I had a really bad tooth and had tried everything, and I'd had to go. I mean, my whole everything just hurt.
I had a very bad fear of dentists before I came here, and he has really helped me in that area. I was very skeptical about coming to the dentist and Dr. Dine, period. I hadn't been to the dentist in 14 years. My teeth was in very bad shape, and he is helping me get them back to where they need to be, and my mouth healthy. They put me at ease with their friendliness and patted my hand and talked to me and asked me why I was afraid, and could tell that I was afraid, and walked me through it and told me what they was going to do. And Dr. Dine's staff is very efficient and very helpful and very friendly and caring.
I guess when I was young, I had some stuff done and it was just painful, and you get those. When I got older and I didn't have to go, I did as little as possible, and it caught up with me, and he needed to help straighten me out, which he did. I'm a regular. I'm here every few months, so.
I chipped a tooth. So I called him, never been here before. They fit me in that day. I told him if he hurts me, I'd never come back again. Didn't feel a thing. And from there on, I've been coming faithfully.
He's not judgmental, and he doesn't lecture you. And I mean, he makes sure your comfort is his number one concern. That's what he's here for. And that's one thing I've never had with any dentist I've ever had. So I'm very pleased with that.
Misconceptions that people have is, number one, they think going to the dentist has to hurt. Well, it doesn't have to hurt. I mean, if you're anxious about the dentist, we can cater to your fears and your worries. We have nitrous oxide or laughing gas available to help relax you. You can even have that when you have your teeth cleaned. People believe that, when they get an injection at the dentist to get their teeth numb, that it has to hurt. But I have a new device called a Dental Vibe, which vibrates the area. You don't even feel the shots anymore. And dentistry has changed where we're more interested in the patient's comfort than I think from a long time ago. So it's just a whole different experience, and there's no reason for patients to be uncomfortable. So we try to make it as pleasant as possible. So that's the biggest misconception about going to the dentist.
Pain or avoiding pain is a major concern for most patients. Technology has significantly helped to reduce the amount of pain or discomfort a patient will experience. This modern technology can also reduce the amount of time needed for treatment. Of course, finding this pain-free dentistry and access to great personal care depends on choosing the right dentist, which we work diligently at to stay on top of new dental treatments and advancements in technology.
I find them to be very efficient, very professional. I think Dr. Dine continues to discover the latest technology and the latest training, and he goes to seminars and workshops, conferences, and that type of thing.
The technology at Dr. Dine's office is state of the art. It's pain-free. It's not the old technology that used to thump and bump and make all the noises and scare you to death. It's very soothing, and it doesn't scare you to death anymore. So
Dr. Dine is very up on the latest technologies, very efficient, smooth running office. You don't feel rushed, but you feel like your time has been well spent. What I like the most about the atmosphere is you never have to wait long. You have an appointment, they stick to the appointment times, you're in, you're out, and you get everything taken care of efficiently.
And I've gone to dentists before where I had to wait a really long time. And as a matter of fact, he kind of set a standard for me. I don't wait for any doctors anymore. If Dr. Dine can do it, then everybody else can too. And my general practitioner, I don't wait for him anymore. But that Dr. Dine helped me set that as a standard.
Sometimes I notice that he has different procedures that he uses and stuff, so I'm sure he goes back and has like some retraining and learns some new things as he goes along too. So he's trying to keep up to date, which is a good thing.
That's another thing I like about Dr. Dine. He tries to keep some updated equipment going. He likes new style, new technology of things to do. The cleanliness and everything, as far as he goes, is a lot superior to a lot of the dentist offices I've been in. So I feel comfortable in coming in knowing that he's got late technology, good equipment to work with, and his expertise is the real reason why that I come in.
You're just not a patient, you're a person to him. He makes sure that you're comfortable. He makes sure he keeps you informed of everything he's going to do and what needs to be done. And he's constantly reassuring you everything's going to be okay.
For most patients, regular checkups are scheduled every 6 months. It allows you and Dr. Dine to stay on top of your dental health. As you've heard from some of our patients, things can change in an instant. One minute you can be eating corn on the cob, and the next you have agonizing pain. A tooth can break or an abscess can occur. Regular visits, checkups, and cleanings are really a partnership between you and Dr. Dine. Both you and he will be able to track things in your mouth and anticipate potential problems. You see a physician for regular checkups and physicals. You see the dentist for the same.
When a patient initially comes in, we're going to take some x-rays. Now, I have digital x-rays. There's hardly any radiation involved with a digital x-ray. So I have this machine that takes them without having the film in their mouth. It makes it more comfortable for them. So we'll take the digital x-rays, and they're available instantaneously. I'll go over their patient's medical history with them. I'll talk to them, find out what their concerns are, find out if they're afraid. If they're afraid, we can give them laughing gas while we do their cleaning. I'll do the examination. I'll examine their teeth and their gums. I'll show them the x-rays. I'll go over what I found with them, and we'll do the cleaning. And then they'll speak with my office manager, if they need some financing for the treatment. We have that available. And then we get them scheduled to do their treatment. Now, they could do their treatment all at one time. They can do it in phases. It's whatever they're comfortable with. Some patients can't do it all at once. So I tell everyone they can do 1 tooth a month if they need to. So that's how we handle a new patient coming into the office.
Following this oath, Dr. Dine has an obligation while in his care to bring you to a healthy mouth. Every patient is different, and no dentist should ever treat his or her patients all alike. In the field of dentistry, Dr. Dine is considered a general dentist, which is to say he would be your primary dental care provider responsible for the diagnosis, treatment, management, and overall coordination of your oral health needs. Despite offering all the expected services of a general dentist, Dr. Dine is a specialist in people. No dentist should ever treat a patient's oral care with a one-size-fits-all cookie-cutter approach.
The fear of going to dentist sometimes gets started when you're a child. And if your first experience with a dentist is somebody that doesn't care, and that kind of sets in your mind into your adulthood. And like I said, we were very fortunate with Dr. Dine that from the very beginning, it was a positive impression. A lot of times when you come to a dentist office, you're nervous. It's not something that people look forward to doing. But when you come to Dr. Dine's office, they make you feel more relaxed. Just from the time that you sign in to the experience, whether they're cleaning your teeth or doing something more than that. Fortunately, because like I said, over 30 years I've been with Dr. Dine, and we have this regular thing where he makes sure my teeth are in good health. I don't have the problems maybe somebody might have that don't have a doctor that they go to regularly.
I just had this overwhelming fear of the dentist. I have very sensitive gums, so sometimes I find dental work to be a little painful. Even though I've never had a traumatic experience, it's just kind of a phobia of mine. He really did make a very scary situation that I was going through just a little bit better. And every time I've seen him since then, he's been very sure to ask how I'm doing, and that really means a lot to me. So he really does go that extra mile to not just treat me like another patient and not just be concerned just about the dental work at hand, but to be concerned about me as a person. And that really does mean something.
We have nitrous oxide, it's also called laughing gas, available. So we have that available even when you get your teeth cleaned. I have patients that come in just to when they get their teeth cleaned, that they need something to help to relax them. So they can have nitrous oxide, even when we do any procedure or have their teeth cleaned. I also have an instrument called a dental vibe that vibrates the area where we're going to give a shot so you don't feel the shot. I've had some patients that may needed some pre-medication before they come in to help relax them. So it's just a matter of listening to the patients and understanding that they're afraid. You have to be really understanding. Patients they are just terrified. Some patients are just terrified of coming to the dentist. I've had patients who, as soon as I walk into the room, they just start crying. So you have to understand it. People are afraid. This is the biggest problem in dentistry, is fear. So we do our best to try to alleviate the fear and make it as comfortable as possible. I had patients that we've given laughing gas to, and we're scared to death, and then all of a sudden they say, I don't really need that anymore. Or they come in and they're scared to death, and then as we go along, they said, yeah, I'm not afraid anymore. If you treat them well in the beginning and understand what their problem is, understand their fears, you can make them feel a lot better about coming, which is going to benefit them because then they'll actually take care of their teeth.
Some dentists don't care. They just want to get in there and get the job done. Dr. Dine's extremely efficient, by the way, but he doesn't waste any time. You can tell that he's extremely efficient on every tooth, every surface of your tooth, but he doesn't miss any of them all the way around, and before you can blink your eyes, he's finished because of his skill.
No one likes to go to the dentist for a routine cleaning or checkup and hear they have a cavity or need a root canal or something more major. However, it's the doctor's responsibility to discuss potential situations with you. It may be unpleasant to hear, but Dr. Dine will always offer customized solution options and a plan for tackling whatever the situation may be. There's always a solution. This is where experience and expertise and years of continued independent practice matters. If you ever go to a dentist and he or she isn't discussing your dental health with you on an ongoing basis, you should find yourself a competent, experienced dentist who will. It is his moral and ethical responsibility to you as his patient to care for you. You want an experienced and expert dentist taking care of you. Dr. Dine will never suggest or recommend treatment that isn't in his expert diagnosis, necessary at one point or another just to suggest the treatment. Suggested or recommended treatments do not always, often rarely, need immediate attention. The planning and timing of a treatment plan, if needed, will be a collaborative one decided on by both you and Dr. Dine that is best suited for your treatment and situation.
He's just very down to earth, very upfront, very soothing. Like I said, he's got a soothing voice, very calm. He doesn't put on any, shows to get people to come in. He's just normal man. So I've been to other places a long time ago, and they were it was more of a corporation instead of a family-oriented company. They just wanted to get your money and get you out, basically. He's not like that.
Relatively simple office. Like I said, it's not this big, huge, elaborate operation that's going to end up, they throw a lot of extra cost on you when you have those big, fancy places. Those things aren't free. And I've always been happy with the, Dr. Dine, I think, really tries to keep the cost down. That matters a lot. It's, and it's not like he's sacrificing any service for it either. In fact, I think the service is better. I like how Dr. Dine's office is they keep it kind of a relatively small operation, and it's much more personable. It's not like a big elaborate operation where you don't know what dentist you're going to see when you come in. He's the one that actually is in there working on my mouth the whole time. I appreciate that.
Another reason people are nervous about going to the dentist for an exam or assessment is because they think dental treatments and procedures will cost too much. Finding first-class care and treatment is important. Surely you want that for yourself, your family, your kids, especially if you didn't get it as a child. But it does have to be paid for, and your concerns are understandable. Insurance and a number of financing options can make your needed care affordable.
As far as financing is concerned, you can pay as we render the treatment. If the treatment is going to take several visits, you can divide it up over the visits. We also have financing through Care Credit, which you can do 12, 18, or 24 months, same as cash. So we have a lot of options available.
We don't want to scare you about the investment in treatment, though it does need to be discussed. We understand that running a household and raising a family is expensive. We're people just like you. We have regular monthly expenses too, like cell phones, utilities, and car payments. We're all able to manage those expenses on a monthly budget. Your dental care and extended treatment, if necessary, also can be put on a budget. We'll help you find a way to make your dental care affordable.
Dr. Dine's office has helped me with the financing. They have put me in the right places that I need to be. I do have some dental insurance. Don't have a lot of dental insurance, but they have helped me get the financing that I need.
I have $2 in different dental practices, but I keep coming back to Dr. Dine. For me, he does everything much better than everybody else does. I could get almost for free at my $2 places, but I don't want to go there because Dr. Dine's so efficient. Every time that he works with me, he checks thoroughly everything that I need. And other dentists, sometimes they don't even come in and check if they have a hygienist. I don't like that feel. I like the personal attention that I get from Dr. Dine.
The investment, I think, is, well worth it. Yeah. And I'm very happy. And I still have a little bit more work to do, so, I will come back in.
They said he was painless and he was really nice and like calming, and I have anxiety so terribly. So he was out of my network still, but the prices were comparable, so I just came here anyways and loved it. And now I get everyone to come here. They're annoyed with me. And I'm just like, you have to try him. I promise you're gonna love it. So always, I'm so excited about this place.
When you smile, the world smiles with you. Cry and you cry alone. A person's smile is a focal point, the thing people often notice first. If you've ever been secretly ashamed of your smile or personal appearance, then know that your experience in this practice with Dr. Dine will be transformational. Dr. Dine as your dentist takes his role in helping you very seriously. It's our responsibility to help transform you into your future self, a more confident person with a greater self-esteem, someone who can share their smile and true self with the world. You can shop around for dentists, and you can look at websites, but the only true test of a great dentist will be in the experience with them. How do they make you feel, and what kind of results do you get? Only you can decide how important expert diagnosis, treatment plan design, care and aftercare is to you. It's not important to everyone. If that sounds a bit harsh, I suppose it is. Our patients tend to be the kind of people concerned and conscientious about finding and receiving the best care they can afford. They understand value is more than just price. That's why you're here, and we want you to know you're in the right place.
This office is very prompt. I am so accustomed to going to dentists where you sit for 30 minutes before getting in, but they're very quick to get your paperwork to you, get it filled out, and then you get back in 10 minutes and you're out 25 minutes later. Regardless, I actually was concerned at first because I had allotted an hour and a half for a cleaning, and I saw that there were several other patients, and only Dr. Dine was here, and it was still 20 minutes, and I was out. It was great.
I was actually in search of the Snap-on Smile, and Dr. Dine was the only one in the area that really had it, and that's what initially brought me in. He's one of the best dentists I think I've ever gone to.
I think a lot of people avoid the dentist because they're afraid, and it's, I guess, a little intimidating, but Dr. Dine is very relaxing. He doesn't try to inflict any pain, he does everything as comfortable as possible and tries to make the process easy for you. It has definitely been a life-changing experience to have the dentures done. Like I said, I have no problem smiling and getting in photos, or I just feel more like I have more confidence, when I'm engaging with people. I'm not hiding my mouth or when you're talking. It's just, I feel more comfortable.
If you've ever had that fear, ashamed of being afraid, don't be. That they're going to welcome you with open arms and help you through it. Not just say, okay, let's get her in, get her out, but they actually help you with that fear, which is really good.
Not wait 14 years to come to the dentist. Your teeth aren't worth losing, and you need to take care of them.
I feel like I'm taking better care of myself, where before I was so ashamed and I have to get a different dentist for every different thing that I had going on, that it didn't give you that accomplishment feeling, to where now I'm like, oh yeah, I got that down, okay, this is next. And it just, makes you want to come back. It makes you feel like you're actually accomplishing something with your health, because your health has your teeth have a lot to do with the overall health of your body.
If he can work wonders with me, he can work wonders with anyone.
The dentist you choose should have a solid reputation for helping you get the results you desire, whether it's for annual checkups and cleanings or more extensive dental care. There's sometimes a temptation to procrastinate. We hope you won't do that. Putting this off can have real health consequences. It can make care and treatment more difficult and costlier. Today, right now, is a great time to get started. We've made it easy and possible for you. It starts by calling our office at area code 513-829-9700 and making an appointment that's convenient with your schedule. Once you've done that, you'll need to complete a new patient form for yourself and/or your family member. You'll find our new patient forms included on this DVD. Simply pop this disc in your PC or Mac and access the disc via either Windows Explorer on the PC or Finder on the Mac. We've included both the child and adult new patient forms. Print yours out and complete the form. You can then bring the completed form with you to your first appointment, and you won't be handed a dreaded clipboard like they do in most all other dental practices. We respect your time and won't delay you any longer than necessary. Thank you for watching and choosing Dr. Dine. We look forward to meeting you very soon.